Hello, my friends. Welcome back to this video series on COVID-19 update. This is video number 7. I hope you and yours are staying healthy and away from coronavirus. We are going through this challenging time, and I was asked 2 questions to see if we are at the peak right now and where to get the information. I go through the numbers and I'll give you some information on websites to see if you are at the peak or not, because we are in different stages of the curve. So it depends on the area you live. Your country, your state is different. So you get the information from these projected curves so you know if you are at the peak or not. But regardless of that, we know together we can overcome this challenge. We can pass through these dark days. We are human. We are social being. We are together. We support each other. We have done it before, many, many times. And we know that we can go through these dark days. We can overcome these challenging days. Together we can, we should, and we will. Let's get the information, the news first, negative and positive, and then I'll give you the information on different websites so you can get reliable information from. This is yesterday. So yesterday we had the total death of 82,000 and total recover of 301,000. And today we have 87 total death and 318,000 recovered. Basically, this information comes from mostly the people. They have to go to hospital, or they have severe symptoms enough to get the test. So basically the recovered people are much more than these. However, if you compare the 2 columns of death and total recovered, you see the total recovered actually is on rise, and this is very good news. If you compare the 301 to 318,000, is roughly like 17,000 increase compared to yesterday, while the death was about like 5,000 or 6,000 more than the day before. Yes, we are going through a challenging time. However, it's good to stay positive because we know the recovery from this disease is possible and we can do it. Now let's get the information on the websites. Okay, so about the website that you can get the information from, this is Johns Hopkins website, which you can see actually the URL address coronavirus.jhu.edu /map. This is on coronavirus, and the next website I'm going to show you is Worldometer. So on Worldometer, there is, when you go down on the page, besides the information you get on total number, you see the statistic country by country. So you get a lot of information from this website, like the total number, new cases, total deaths, new deaths, total recovered, active cases, serious and critical patients, and total cases per 1 million population. Same with deaths per 1 million population, and total tests. So here it shows that, for example, United States, so far we have done 2.2 million tests, And so you can go through other countries to see how many tests they have done, and the tests per million also. And then on United States, you can actually click on that and go through the different states. So you get this information, the same information for different states, to see how many tests in your state have been done and where you are right now. Another website that you can get information from, this website, covid19.healthdata.org or .org. It shows you different countries, and I'll show you actually later on about how you can get to different countries and different states, but there are a lot of useful information here, and it shows you, for example, in United States, we get to the peak on April 12th to 13th. And after that, the curve will go down. And just bear it in mind that this is based on the information we get and based on the projected information for the future. If we assume full social distancing, or I call it physical distancing, through May. So be careful if your state is already peaked and you are on the down slope of the curve. It doesn't mean your everything is over and you can do whatever you want. Be careful and follow the CDC guidelines and your state guidelines. Okay, so here you can change, actually, it shows like different information about the, for example, all beds needed, and ICU bed needed, and invasive ventilator needed. These are the dashed line is the projected line. So for example, here on United States, you can go state by state and see these numbers, and you can see other countries. Unfortunately, it doesn't have every country in the world. However, those countries that they provide enough information, they are on this list. So, for example, here, if we go to New York, let's see New York. And now here you can see the number of beds needed, and you can actually click on these icons and see only one variable. So this is this solid line is all bed available, and this curve is the bed needed. So in New York, we know that it's not, they are not in a very good situation, unfortunately. However, with these preventive measures, the number of deaths actually is much less than if we would not to have these preventive measures. So generally it works very well. It depends state to state actually, and so you can get information, a lot of information here, and see when the preventive measures started and what they did in your state or your country. So basically you can change the information and get the information on your state. So for example, in California is much better. They are in much better situation regarding the number of beds needed and the number of beds available, and regarding of ICU beds, the ICU bed available and ICU beds needed, and invasive ventilator. For example, in California, we need 696 ventilators. So California is in a very good shape relative to New York, for example. So here you can get whatever information you want based on your state and the country you live. Okay, my friends. So it's good to stay positive, safe, and healthy and go through these difficult and challenging times all together. Don't forget to subscribe and share these videos with your family and friends. And we like to hear the stories, your stories or your family and friends' stories about COVID-19, about what you do, how you are helping your community, your society to overcome these challenging times. Thank you so much for watching and see you tomorrow on the next video.